Great, well, welcome. My name is Tim Kelsey. I'm the Senior Vice President for HIMSS Analytics International. And it's my great pleasure to be joined by Vanessa Janison, who is the National Director of Strategy and Service Development for one of Australia's leading health systems, Calvary Care. And today we're going to be talking about a really an unprecedented initiative that Calvary and HIMSS have worked upon over the last 6 months to assess the digital capabilities of Calvary Care, looking at it in a whole range of different dimensions, but most importantly, looking at it using the new digital health indicator. And this was really the first time that the digital health indicator was used to assess the digital capabilities of a whole service. And as we'll hear, Calvary has a significant footprint in terms of care services across Australia, serving communities right across the country. So Vanessa, perhaps I could pick up there and just ask you to introduce your role perhaps at Calvary, and also just to say a little bit about Calvary as a health service.
Thanks, Tim. Yeah, so as you described, my role as National Director of Strategy and Service Development. So I help the organisation really translate their vision into key strategic directions, define what those strategic priorities are, help look forward to implementing those, whether they be in areas of strategic, operational planning, or service development in terms of capital development, acquisitions, mergers, partnerships, etc. So Calvary is an organisation that's been around in Australia for 135 years. It was founded by Mary Potter, a sister of Catholic heritage, and in 135 years ago. And we have a range of services across 5 states and territories. Those services cover public and private hospitals, aged and retirement living, and community care. So broad range of services that we're providing to the communities in those areas.
So what was it that, looking at the outcomes, looking at the service that's provided, what was it that motivated you to want to really look at your digital strategy as an enabler of improvement?
So in the last couple of years, we've been thinking about the future of the organisation and looking to really pivot our direction. Previously, we were very siloed in the way we thought about our services, structurally and technology-wise. Looking at public hospitals, private hospitals, community care, aged care, in very defined silos and requirements. And what we know is happening in healthcare is that there's a growing demand from the community that services should be integrated across. And we were hearing that from the people we care for inside our services. I remember the first month that I was with the organisation, I was at one of our retirement communities, and I had a little old lady come up to me and say, "I don't understand why I live here in your community, but I can't go to your hospital. When I am sick, I have to go to a different hospital." And so it really spurred us to think about, well, actually, we're a system. We have all these different services, but we're not connecting them together. And that's what our community wants. And we think we'll get better outcomes for our community by taking them through their care, through their life and their journey of life, caring for them across those services. And so similarly, technology needs to enable that. And our technology was very siloed. And so we wanted to think about that differently. How could we connect our systems, our technology, and enable that connected patient journey as well?
Great. And actually in the project, just for people's awareness, HIMSS, the team here, deployed all the maturity models tools and the digital health indicator. So we looked in real detail at the digital capabilities and where the gaps were and where the opportunities arose in relation to building the foundations for exactly what you've just described, more integrated, outcomes-oriented healthcare. We've now completed that piece of work, and we put together the final report, which I think identified a number of potential strategies for building the digital roadmap. How would you reflect on those kinds of the proposals that came out of all that work?
Yeah, so I think the maturity assessment was really good at giving us that sort of baseline as to where we were sitting and how we would prioritize the next steps forward for us in getting that integrated system together. The areas that we were obviously good at, governance and workforce, but there were areas that we needed to improve around person-enabled and predictive analytics. So the priorities for us that the maturity assessment raised were really looking at how do we support our patients, residents, and customer and clients. So having person-centered apps that actually help them through their journey with us. Helping our staff to provide the support that they need to do to make their job easier, to feel like they're getting the support that they need to do that work, and feel a sense of loyalty to the organisation because we're helping them, and then looking at how do we create a really high quality journey through the system, whether someone's in our hospitals, receiving treatment outside of our hospitals, or being supported in our aged and community setting.
One of the things that I think HIMSS has learned over the years is the importance of international collaboration and being able to, in a way, talk to peer hospitals, providers, systems, countries about the way in which they've approached their digital journey, and hopefully, therefore, accelerate learning about best practice in implementation. During the course of the work we did for Calvary, we hosted a conversation with the University Hospital in southern Denmark, which has also been a pioneer in using the new digital health indicator. And I just wondered about your reflections on that, what I thought was an extremely productive and stimulating discussion.
Yeah, that was a great discussion, and it's always good to hear other people's experiences, and surprisingly how similar the challenges are, even though we're in totally different countries and with dealing with different healthcare systems. So it was great to see how they'd approached their digital transformation. They're obviously a lot further along that journey than we are. We're at the start, but that was encouraging because we could see how they'd applied, and approached their digital technology transformation, how far they'd come, and the outcomes that they were achieving as a result, which are what obviously we're setting out to try and do as well. So it's good to see that it actually can happen. It seems a little daunting at the outset, and I think in terms of at the moment, particularly with COVID, galvanizing countries around the world and healthcare systems approaching the same sort of challenges. It's really important to be able to reach out and share those experiences, and particularly in the digital space, because we know COVID is really ramping up. The opportunity and the necessity to adopt new digital pathways for patients.
And actually, just talking of COVID, of course, we were conducting the assessments virtually during the course of, after COVID had struck, and clearly there was a real appetite, we felt, amongst the senior managers and across the organisation, actually, in Calvary, for action to support them fill some of those gaps that digitally hadn't been worked out previously. And so the question really is, now you've got the data points on which to base the roadmap, and you've got the recommendations for moving forward. What do you hope will be the single, if I can pick out one thing, what one thing do you hope will have been achieved in the next 3 years for the patients and clients of Calvary?
Look, I think if there was one thing, it would be that really seamless journey, that they feel like we're a system that's wrapping around them, and being much more proactive about what their needs might be, and helping them navigate what can be a really complex healthcare system, in between public and private. I think if we can learn more about our the people we care for, what their needs are, and be more in touch with them, and and being able to see where those connection points can be, I think our customers will feel a lot more cared for. And that's, at the end of the day, that's what they want. They want to be, you know, responded to with trust and care for their health. And so I think if we can put in place some of these digital foundations, we'll really, you know, be able to help them on their journey and their you know, their care outcomes. But also, I think it's, you know, it's really core to what we do in our mission as an organisation around being for others. So it'll help our staff feel like we're really living and breathing the mission of the organisations and the mission that the Little Company of Mary Sisters intended for us to deliver.
Great. Well, thank you very much, Vanessa. That's been fantastic.